Welcome to Invest Insights. I'm Abby Maloney. I'm joined today by Andy Marino, the president for Truli for Health, a new Blue Cross Blue Shield insurer in Florida, built from the ground up to provide long-term affordability for small and medium-sized businesses. He joins us for our discussion on the COVID-19 pandemic. Don't forget to like this video and subscribe to our channel for more insights like these. Andy, first, can you tell me a little bit more about Truli for Health? What is this new healthcare plan, and what need was it intended to solve?
Well, first, Abby, it's great to be with you, and thank you for having me. Before I jump into the what it is we're trying to solve, let me just make a few comments about who we are as an enterprise. Some of your viewers may not be as familiar with GuideWell. GuideWell is a holding company structure that was formed about 7 years ago. And inside of GuideWell, there are multiple insurance assets, Florida Blue being the largest, but we also have Florida healthcare plans, Capital Health Plan, and of course, our newest HMO, Truli for Health. Collectively, these insurance assets, they serve the employer group market, they serve individual under 65 or the ACA or Obamacare market, and we also serve seniors through our Medicare Advantage Part D and supplement products. And inside the broader GuideWell family of companies, there's other operating entities that do digital health and wellness and consumer engagement. We have some direct delivery assets that where we either employ physicians or own physician groups in the primary care space, specialty space, as well as urgent care centers. And we even have an entity that serves frail elderly polychronics in their home. Each of which of these companies are designed to make our health plan offerings produce better outcomes in terms of cost, quality, and patient experience for both us as a health plan, and many of these companies offer these services to other health plans. Combined, these entities extend the reach of our mission, which is simply to help people in communities achieve better health. But back to the what, and really the what as it relates to our new HMO is affordability. Abby, as you know, healthcare is pretty expensive. It consumes 18% of our GDP, almost $4 trillion on an annualized basis. And the rate of healthcare inflation continues to outpace other parts of our economy, which is really just unsustainable. And we knew we had to find a way to bring trend back to more like CPI. And we also noticed there's tremendous frustration in the marketplace, frustration from business decision makers who have to fund benefits for their employees, the cost of healthcare for their own employees, as well as the benefit consultants that work with these employers. And we recognize that this frustration was really just an opportunity to do something that's a little more transformational and really impact affordability by building a model from a ground up, which has some really unique features that impact many of the drivers of healthcare costs and inflation, but with a particular focus on managing individuals with chronic conditions, improving the way we coordinate with each and every member's primary care physician, and building an economic model that better aligns incentives and shares in the value we create together. All of this is done through partnership with some of the region's leading health systems and physician groups who share our vision for a more sustainably affordable healthcare, and it all starts in South Florida in Orlando. These partnerships include really well-known names like the Cleveland Clinic in Weston and their affiliate locations, Martin Health in Indian River, Orlando Health, HCA Central Florida, Baptist South Florida, Jupiter, Wellington, Pediatric Associates, which is one of the largest pediatric groups in the state and has amazing virtual care capabilities, our owned assets, GuideWell Primary Care, GuideWell Emergency Medicine doctors, as well as our JV partners with Sanitas and their 35 locations across the state. And I'd be remiss if I didn't point out our partners in the Mayo Clinic up in Jacksonville, who serve as a center of excellence for rare and complex conditions. And this partner list will continue to grow as we expand the Truli model into other markets, including someone you recently interviewed, Mr. John Corris and the Tampa General team, who are doing some really amazing, innovative things in the Tampa Bay market. So to summarize, Truli was built to address affordability for local employers who are looking for a more predictable way to fund benefits for their employees and dependents, starting July 1st in Orlando and South Florida. And it does it in a way that complements what Florida Blue already does really well and kind of rounds out our offerings that we make available to small to mid-sized employers who, as you know, are the backbone of the Florida economy. Okay.
What has it been like to roll out this healthcare plan during a global pandemic?
Great question. We get asked that a lot. In full disclosure, the strategy for Truli for Health has kind of been in the works for about 2 years. So we definitely did not have the foresight of saying, hey, we want to bring this new solution to market right when employers were struggling the most. So things like plan designs and who to partner with and how to structure those partnerships, they were all pretty well baked prior to the COVID crisis. But one obvious reality of launching into a pandemic is the impact to market size. If you think about what Truli for Health is focused on, and it's serving small to mid-sized employers, those that have been most impacted by the COVID crisis, and as unemployment moves from historic lows to historic highs, the total addressable market for who it is we are trying to serve is clearly going to get compressed. That's just the realities of launching into a pandemic. But prior to the COVID crisis, there was another crisis in the marketplace, and that was the crisis of affordability. So pre-COVID, small to mid-sized employers were pretty price sensitive. And we think that this price sensitivity dynamic is only going to be amplified in the current environment, whereby local businesses are impacted by shelter in place or closing of non-essential services. So we think of it kind of now more than ever, there's a real appetite for new and innovative ways to fund health benefits for their employees, which we think is a good thing for Truli. Other factors that impact us as we launch into a pandemic, when we do new product launches, there's pretty extensive training and go-to-market planning. All of that had to be done virtually. So we trained our internal sales folks, our distribution partners, our provider partners, all virtually. Not ideal, but clearly the new normal. And then even how we plan and execute this go-to-market plan with 90+% of our workforce working remotely is not without its challenges, but the teams have adapted really well and showed great resiliency. And we as an enterprise, Guidewell, Florida Blue, Truli, FHCP, we view Truli as part of our enterprise response to the COVID crisis and all the things we're doing as an enterprise to help employers who have been very much impacted.
And how is Truli for Health different from other healthcare plans?
So if you think about it, we built from the ground up a more integrated financing and delivery model. We think of it as an asset-light staff model, which is really quite unique to the commercial group market. We use a brand new delivery model, so a new network of high-performing doctors and hospitals. We use a new financing model to better align incentives and get away from kind of the fragmented fee-for-service world. We take a new approach to care management and value-based insurance design that use benefits to keep people on their care pathway to better manage chronic conditions. And then we shamelessly share data and analytics with our primary care and hospital partners to kind of get them thinking about spend and trend and quality the way we do as a health insurance carrier. And it was built in a way that replicates some of the economics of health plan ownership for our partners inside this model, so that they're very aligned with us in terms of supporting its growth and our mission and our focus on affordability, which is really unique for the commercial group market. There are variations of this model in the Medicare Advantage market, but Truli is the first to bring this type of solution to Florida for the employer group segment. And speaking of Medicare, it creates a great on-deck circle for both us and our provider partners who are really focused on serving individuals as they age into Medicare. It's what we internally call our Stay Blue strategy. And Truli was built in a way to do this in a more seamless manner compared to most group products that are generally open access and more fee-for-service in nature. So those are just some of the unique features within the Truli model that really differentiate it in the marketplace and ultimately will produce more sustainably affordable premiums for our clients.
When I think of the size company that you are intended to use, the small and medium-sized company, I think about how hard they have been hit during COVID-19. What have been your observations amongst small and medium businesses during this time, and how would you foresee Truli for Health taking a place in the recovery process for them?
Sure. So if you think about shelter in place, and it has caused significant cash flow issues in the marketplace and ultimately liquidity and some solvency risk for small to mid-sized employers who may not have the balance sheet of larger organizations, they intuitively know keeping their workforce healthy translates into more productivity, and that's good for their bottom line. So pre-COVID, there was a real appetite for new and innovative ways to fund benefits for their employees. And now more than ever, that appetite for new innovative ways has only been amplified. So we think the value prop that is Truli for Health as a new HMO that was built from the ground up to produce more sustainably affordable results, we think that value prop will resonate even more so in a post-COVID dynamic. So we're really excited to bring this solution to market. You know, I'd love to say that we were smart enough to know we had to build this 2 years ago to be ready for this dynamic, but that certainly is not the case. It just so played out that way. But we're really excited about partnering with a lot of our health system partners and all the assets and capabilities that sit within GuideWell to make this innovation a reality.
And should our viewers want to find out more information about Truli for Health, where would you guide them?
You can go to our website, trulyforhealth.com, Truli, so truly with an I, for health.com. Or if you're an existing Florida Blue customer and have questions about some of the accommodations we've made during the COVID crisis, or if you were previously covered under a group plan and now find yourself shopping for individual coverage, you can go to floridablue.com.
Wonderful. Well, thank you again. That was Andy Marino, the president for Truli for Health. Don't forget to like this video and subscribe to our channel for more insights like these. My name is Abby Malone, and you have been watching Invest Insights.
Thanks, Abby.